Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about the safety of ultrasound and why we try and limit scans when we are doing ultrasounds. Now, for those of you who may not know, the standard in Canada is to get 3 ultrasounds. Now, I say standard, I guess like roughly the standard is about 3 ultrasounds. Some people only opt to get 2. And the first one is going to be the dating scan that is offered. So this one is going to be done in the first trimester, and it is exactly what it sounds like. We are trying to get a basically gestational age, a estimated due date from that scan, and that is going to date the pregnancy. So essentially just how far along the pregnancy is. The second scan is going to be the nuchal translucency scan, and that is a genetic screening tool that we use at around 12 weeks in combination with a blood test, and that one is optional. So that's why I say, 2 to 3 standardized tests, since that second one is going to be optional. It was only offered to those moms who were high risk, but now it is offered to everybody. And the third scan, which in my personal opinion is one of the most important scans, is the anatomy scan. The anatomy scan is done between 18 to 22 weeks, although we usually try and book patients between 19 and 20 weeks. And as the name implies, this is where we check all of baby's anatomy. We check baby from head to toe, and just to make sure that we do not see any sort of structural abnormalities. And if we do, then there will obviously be further scans. But long story short, basically there are 2 to 3 scans that are going to be standard. And of course, if you are high risk, then you'll be having more scans, such as if you do have an abnormality that is found in your pregnancy, then you are going to be getting more scans. Or if there are any concerns that pop up in the third trimester, whether that be having decreased fetal movement, having baby being bigger or smaller than what is normal, or at least what your doctor is predicting to be normal. All of these are going to be reasons for you to potentially have another scan in your third trimester. And now I know a lot of patients tell me that it seems like such a long time to wait between the 20-week anatomy scan until delivery to be able to see baby if they are having a normal, healthy pregnancy. And of course, I can totally get that. That is a really long time. Essentially, you are going to go from the second half of your pregnancy until the very end when you give birth, potentially not seeing baby at all with ultrasound. And I can understand that this may cause a bit of anxiety because you don't know what baby's doing in there, etc. But something really important to know about ultrasound is, although it has been proven to be safe in the way that we are using it, as in when it is medically necessary, having more scans than what is medically necessary, or going out and doing kind of your own like entertainment scans, so at those 3D, 4D clinics where there may not even be qualified techs doing the scans, is really, really not recommended. This is because the ultrasound does heat up tissue both in mom and baby to a certain degree, and especially if Doppler is used, then that is going to heat up the tissue even further. Now, of course, just ethically, we can't be doing scans or experiments on pregnant moms to see at what threshold is the ultrasound going to be causing birth defects or just more serious issues. So we can't really be experimenting, obviously, on people in an ethical way in order to kind of gauge where that threshold of safety is for ultrasound, which is why we always then try and limit not only the exposure time to ultrasound, but also the power coming out of our machine. As I kind of mentioned earlier on in this video, with those entertainment 3D, 4D clinics that you have to pay out of pocket for and are not for medical reasons, they're just to see baby or just for fun, those are really not recommended because that is exposing baby to more ultrasound than what is needed. And also, a lot of those clinics are not regulated. They do not have techs that are trained on certain principles, like the ALERA principle, which is as low as reasonably achievable, which means you are going to try and get your images in the lowest amount of time with the lowest amount of exposure and the lowest amount of power coming from the machine. So obviously you can see that there can be issues arising when people are not trained for these ultrasound machines and they are exposing these pregnant women to more ultrasound than maybe what is needed. And I mean, in the end, obviously I don't want to scare you guys. It's probably all okay, right? Like, it's probably fine, but the risk versus benefit is always going to be weighed out. And of course, if there is a reason to have to follow up baby and the benefits obviously outweigh those risks of being exposed more to ultrasound, like again, you're in the high risk category of the pregnancy, or there were some abnormalities seen in the second trimester that need to be followed up, etc., then the doctor is going to deem that the risks are lower than what the benefit would be to follow this sort of abnormality, and therefore more scans are going to be ordered. But long story short, this is basically why we try and limit the exposure of ultrasound to mom and baby, and why there are only 2 to 3 tests that are standardized in a normal, healthy pregnancy. And although ultrasound has not been proven to show any sort of harmful side effects when it is used when medically necessary, we have to remember that when you guys are going to like these entertainment clinics and when more scans are being done than what is needed, then there is that risk of heating up the tissue. We all know that ultrasound does this, as in we all know as healthcare professionals that is what happens. And therefore, we do want to try and just limit that exposure just to minimize, obviously, that risk that any sort of abnormality or any sort of harm is going to be caused to mom or baby because of the ultrasound. Hopefully this video has been helpful for you if you have been questioning either the safety of ultrasound or why it is that you are only seeing baby at the anatomy scan and not after that if you are having a normal healthy pregnancy. And like always, if you guys liked this video or if you found it helpful, please like, comment, and subscribe to my YouTube channel. Or you can also check out my TikTok. I make videos over there as well.